Ladies and gentlemen, thank you for standing by. Welcome to the Webinar 1 Intro to Social Norms Change. During the presentation, all participants will be in a listen-only mode. If at any time during the conference you need to reach an operator, please press *0. As a reminder, this conference is being recorded Thursday, August 7th, 2014. I would now like to turn the conference over to Jim Keddy. Please go ahead, sir.
Yes, good afternoon, everyone. This is Jim Keddy. I'm the Chief Learning Officer here at the California Endowment. And welcome to the part one of a three-part webinar series we'll be holding over the next few months on social norms change. Here at the California Endowment, over the last number of years, we've become increasingly convinced of the importance of norms change and the role that communications can play in norms change in terms of creating a healthier California. We believe that social norms change takes place when a critical mass of people reform their actions and revise their underlying views on an issue, and through this revision contribute to significant long-term social transformation. And, as with many others, we see a very critical relationship between norms change, communications, and social movements. So today you'll be joined by two of our other leaders here at the California Endowment, Dr. Tony Iton and Daniel Zingale. In terms of housekeeping for the webinar, as you heard, it's being recorded. We will be taking questions through the chat function on the lower left part of the webinar screen. And please dial in using your phone to hear audio. If you have any technical difficulties, you can see on the screen there the phone number and the email to call for help. And again, these are the three folks from here at the Endowment who will be leading the webinar from the Foundation, myself, Dr. Tony Iton. Tony is with the Healthy Communities Department here, which is over our place-based work in 14 communities, and Daniel Zingale, who is over our statewide advocacy and communications work. We'll also be joined by RJB from Hattaway Communications, a leading communications firm. And RJ will be presenting us with some analysis that his firm has done for us, examples of successful norm change efforts. Okay? So now I'm going to go ahead and turn this over to Dr. Iton. And Dr. Iton will share with you some of what we think is some of our thinking on norms change and how it relates to health.
And hello, everybody. I hope you can hear me and see the slide that's up in front of you. It's called The Importance of Narrative. And I'm just going to go through just a couple of slides talking about why we think narrative is so critical to health improvement at the population level. This is a slide of Alameda County. It's a map of Alameda County showing 150 census tracts in Alameda County, and it shows life expectancy, the average age to which people can expect to live in Alameda County neighborhoods, with the green ones being greater than 80 years, the red ones being less than 74 years, and the yellow is in between 74 and 80 years. And when you do this analysis, which you can do just looking at death certificates and using the census, you see that there are life expectancy differences in Alameda County, that's in the Bay Area, that are as great as in the lowest being about 66 years and the highest being approaching 90 years. So you see 15, 18, 20 years life expectancy differences just between neighborhoods in Alameda County. And it's not unique to Alameda County. You can also see this in Cuyahoga County, Cleveland, which is that little map on the lower left. You can see it in Baltimore, Maryland, where they have life expectancy gaps that approach 30 years. You can see it in Los Angeles. You can see it in Seattle, King County. You can see it in New York City. You can see it in Philadelphia. In fact, the Robert Wood Johnson Foundation did a nice graphic showing that you could predict life expectancy, somebody's life expectancy, based on which stop they got off on the commuter train on the Washington, D.C. Subway. And so in our work, we try to explain this, and this next graphic comes from this model called the BARHI. It's a framework called the BARHI framework. BARHI stands for Bay Area Regional Health Inequities Initiative, and it was an effort of 9 Bay Area health departments to try to come up with better tools to address some of the relatively intractable problems that public health agencies were facing. And we recognized that the tools we had at our disposal, healthcare and basically education to try to change behaviors, were inadequate to get at the root of some of these entrenched disparities that we saw manifesting themselves in different life expectancies depending on what your address was or what your zip code is or where you live. And so this model, this is half of the model, and you read it from the right to left. If you go to the far right, you're looking at death or mortality and trying to explain these differences in death rates in these neighborhoods. You walk back to the next box, move to the left, and you see that there are higher rates of disease and injury, both infectious disease, chronic disease, and injury. And then you walk back to try to explain that, and you get to this notion of risk factors and risk behaviors, i.e. smoking, how people eat, whether they exercise, what kinds of stressors and violence they're exposed to. And this is basically the medical model, that behavior produces disease, which produces death. And so the goal is to try to reduce disease and to change behaviors. And the primary levers that you have at your disposal for doing that are health knowledge, genetics, and access to health care. And at BARHI, it was concluded that while this is true, it's not the whole story. And the larger story, which is coming up in this green box, the left part of the model, talks about those neighborhoods that I showed you that have very low life expectancies and the conditions in those neighborhoods is contributing to the risk that people experience that leads to disease and mortality. And when you try to understand the source of those conditions, you recognize that there are a set of policies and institutional practices, or oftentimes the absence of policy in the face of abject need, that produces these conditions. And then when you think about, well, what creates the policy, you're forced to sort of contend with the history of this country and a recognition that there has been a set of isms that have essentially valued people differently in for different reasons, and that creates a set of policies that either favor or disfavor them, which creates a set of conditions for them. And so we talk about the downstream consequences of this being health disparities, but when you look upstream, you're dealing with inequities or injustices that produce the disparities. And you can take the word health out of that and just talk about inequities producing disparities, or if you're simple-minded like me, you can just talk about conditions producing consequences. And we point out that if you look downstream, you can actually substitute the health consequences with educational consequences. And you can see that school absence or truancy leads to grade failure, leads to dropout, and it has requisite consequences on health when you don't graduate from high school. So our argument is that you have to stop focusing so much downstream and start looking upstream, and we simplified our upstream practice to focus on place, which are really the conditions that are shaping people's opportunities in neighborhoods, policy, which is a set of policies and rules that can either create adversity or support opportunity in many of the places across this state. And then finally, the narrative that shapes the policy that ultimately creates the conditions that create this risk or the odds for people being able to be healthy or not be healthy. And we argue that we have to build the power of people to participate in changing that policy, but we also have to change the narrative. And that's basically what this webinar is about. And so now I'm going to toss it back to Daniel Zingale, my co-vice president, to talk a little bit about our efforts to change the narrative. Okay.
Thank you, Tony. This is Daniel. Good afternoon, everybody. So for those of us who work in the field of public health, and particularly I think in the field of philanthropy concerned with public health, when you see data of the quality that Tony just shared with us, it's compelling, and it often leads us to be puzzled or frustrated with the question of why doesn't that translate into a different course, policies that could actually start to reverse those public health consequences along the lines of what the science and the facts like Tony just presented demonstrate so clearly. And I think the answer to that is in one of Tony's last slides there, that narrative often shapes policy. So first you have the problem of moneyed interests, which often trump public health when there's a profit motive. Most of us are familiar with that. But even when you can get beyond that, what has a greater influence on political outcomes, policies, and decision-making than the facts is just sort of the general public opinion, how these issues are portrayed in the public media and how people internalize that or don't. So there's a disconnect. And one of the problems for us, I think, in the field of public health and in philanthropy in particular, is that we're not particularly good in that realm. We're not good at the messaging wars that often determine some of these outcomes. And let me give you an example. Some people refer to effective messaging or having an influence on the narrative by the 4 Ds of communications: development, decision-making, dissemination, and discipline. So I would suggest that our field is pretty good at the first one. We actually invest quite a bit as foundations and public health leaders in developing messages. We have a lot of issues we care about. We've learned, at least in the last several years, that you have to pay attention to how an issue is framed. So we invest a lot in developing messages around the kinds of issues that Tony was highlighting a minute ago. What we're not as good at, as we move down this list of 4 Ds, is then deciding on a message. And by deciding, I mean really coalescing around a message that's shown effective by research and then sticking to it in a way that sequences a messaging campaign. What we tend to do is sometimes have clutter. We'll have a lot of competing messages going at the same time because we know there are a lot of important issues. We have a hard time choosing. Maybe we have disagreements about the way it should be put out there, but we have a hard time with that number 2. Then the third of the 3 Ds is dissemination, just getting the message out there. So even when we are good at deciding on one, you have to really be serious about putting it out there. In a state like California, for example, we have approaching 40 million people soon. Dissemination is a huge undertaking. So often what we'll do is we'll spend our time spending time and energy on developing a message. Maybe at our best we might even agree on one, but then we completely underestimate what it takes to really get a message out there to regular people beyond our own circle, beyond preaching to the choir. We invest heavily in development, not as much in dissemination, which is a huge undertaking. And finally, just having the discipline then to stick with all those things, stick with what you learned about an effective message, with what you've decided, and with a long-term plan for disseminating it. Here's a slide I sometimes use just to illustrate what I'm talking about in the field of public health and a lot of progressive causes generally. We have so much to say. We know things, many issues are interrelated. I'm sure many of you have been behind a Prius. Mine at one time looked something like this, where they've got every issue in the book on there. And to someone who's sympathetic to some of these issues and the interconnections, you might think, well, there goes a person who really cares about a lot of things. But frankly, to your average driver who pulls up behind this car, mostly what they just see is clutter, noise, and they wonder what's up with that person to have gotten so carried away with their bumper stickers. By contrast, this is what some of the opponents of some of the public health measures we push, what it looks like when they do their messaging. They're actually pretty good at those 4 Ds. They decide on a message, they're disciplined about sticking to it, and so you see the kind of dissemination that lends itself to when you have really what can become a movement around something that is just simple, oversimplified by our standards as public health people, but much more effective in the realm of public health. And the last thing I'm going to say, just by way of introduction, is after we hear from some of the experts, I'll just give you a look at some of the ways in which the endowment and some of our partners and grantees are attempting to be better at this. And our Health for All campaign is one example where a very simple phrase, which says a lot about equity and about access to health beyond health care, but just health is an example of where we're trying to do better. I'll share some of that a little later.
Great. Thank you, Daniel.
Thank you.
We're going to now turn this over to RJ from Hattaway Communications. Now, RJ is going to share with you some of their research on lessons from successful campaigns. So, RJ?
Thanks, Jim. Thank you, everyone, for attending the webinar. Just a quick introduction. My name is RJ B. I'm a Vice President at Hattaway Communications based in Washington. We work with a lot of foundations, nonprofits, and other organizations in the health space and in other social areas. So we're going to bring you today something we're calling like a landscape analysis. What we did was we examined campaigns from other fields and public health who are attempting to change norms, whether and you'll see several examples throughout. And what we want to do is really understand what tactics and strategies they offer the endowment when it comes to breaking through the sort of communications noise and really getting the message out to targeted audiences. So the first thing we want to look at is the objectives. We researched communications materials, ads, and outside literature about some of the country's most successful social change campaigns to determine the traits of successful campaigns, how they've changed long-standing norms, and what lessons they can offer for the endowment and its work. So what we found when we looked at these successful campaigns is that most of them shared 6 big traits. The first is that they open people's eyes to the problem. The second is that they humanize the cause and put people in the picture. The third is that they bring together a diverse coalition under one umbrella. Fourth is branding the goal so that people embrace it. The fifth is making it meaningful and easy for people to be part of the solution. And then this last one is to communicate the social and environmental impact on people's well-being. So you'll see some examples throughout, but we'll walk through each of the 6 traits and show some examples. The campaigns we analyzed are here. We purposely went outside of health. We looked at some things like the conservative movement. We looked at the Dreamers. We looked at some things that were outside of public health because they offer a lot of lessons on how to execute campaigns to change norms really effectively. So now we're going to go through one by one. The first one is to really open people's eyes to the problem. And what this means is that we can show people how the work that you're doing actually affects their health. And this is something that we've found in some other research we've done, is that it is a challenge to connect the social determinants of health with people's day-to-day lives. So thinking about ways to do that in more effective ways will be helpful for all of you, we hope. So the first way to do that is to call out bad actors. What you see here is a slide from the Truth Campaign, who's been really effective at calling out the tobacco industry. You'll see that this is an ad that shows some of the tobacco industry's own market research, which they describe women as lacking control or vulnerable. And when showing this type of ad, it really helped to turn young people against the tobacco industry, even if they didn't necessarily believe or care that smoking was bad for them. It was the manipulation or the stereotyping that really angered people. And you'll see a quote here on the screen from someone from Porter Novelli, an ad agency, that said, "The Truth Campaign showed young people which companies were supporting the message and provided them with new ways to evaluate advertisements and promotions they saw about smoking." So when it comes to the social determinants of health, obviously there are a lot of bad actors to invoke, including energy companies, soda companies, food companies, other industries. So we think there's a lot of potential to think about this and how this could be helpful to your work. Another way to open people's eyes to the problem is to what we call picking strategic fights. This is highlighting specific incidents of bad behavior to create news value. And what you see here, I'm sure a lot of you are familiar with this, the Human Rights Campaign has a program called Call It Out, which spotlights acts of hatred or intolerance toward the LGBT community. About a year ago, they organized a rally around the country against Chick-fil-A when the company had been opposing marriage equality publicly. So these acts are not only intended to publicly pressure a brand like this into changing their behavior, but even if that fails, it really draws a lot of attention to the problem because it draws people's attention and it's an easy story for the media to cover. So this tactic of picking a specific high-profile battle is something that could be done in campaigns like Health Happens Here. So another one here that we wanted to share is surprising people to capture their attention. Again, focusing on open their eyes to the problem. This is an ad from the campaign for tobacco-free kids. And what they did, they used, as we say here, jarring images of young children smoking cigarettes to convince Congress to crack down on tobacco companies. And this is from the early 90s when Congress was considering legislation to limit tobacco marketing aimed at children. So what this does, it really captures attention through surprise, and psychological research tells us that surprising people captures their attention and increases their alertness for a few minutes afterwards. So that's great for communications because you really only have a limited amount of time to capture your audience's attention and allow them to absorb your message. So the more that we can use this in our own work to surprise people and potentially connect the social determinants of health with surprising facts and figures and about the problems, that can really help to rally people around the cause. So the last one in this section is using Hollywood. And this is actually a designated driver campaign. And the concept of designated drivers is so commonplace and universal at this point that it's surprising maybe that this was actually strategically introduced through a campaign largely from the Harvard School of Public Health. And one of the ways they did this was to use Hollywood to make this norm seem acceptable. They encouraged studios and networks to start including the concept of designated drivers into TV shows and movies. And this quote on the screen here is just an example of a piece of a script from Cheers, in which Carlo, the bartender, is sort of admonishing Norm that he can't drink because he's the designated driver. So this is a really great example of incorporating a new norm into a public dialogue pretty seamlessly. And so there may be potential to leverage those connections to get more exposure for the social determinants of health in various ways.
Hey, RJ, this is Jim. Just to jump in and remind folks that if you have questions for any of the speakers here on the webinar, please go ahead and enter them into the chat function on the bottom left of your screen. And after we go through RJ's presentation and some more slides from Daniel, we will be asking our speakers here to respond to questions that you've submitted. Okay, thank you.
Great, thanks, Jim. So the second thing that we want to think about that all these campaigns did successfully was humanizing the cause and putting people in the picture. Really, this is something we talk about a lot as a communications firm. You really want to put people visually into the picture and also into your messages and narratives as often as possible, because it really helps outside people identify with the cause. So the first way you can do that is help your audiences see themselves in the cause. This is again from the Truth Campaign. What we say here is that by showing a broad audience engaged in the conversation about tobacco and tobacco companies, the Truth Campaign has done a really good job to make even non-smokers feel a stake in big tobacco. This ad that you see a screenshot for has a sort of moderator-type figure who approaches people on the street, points at a billboard that shows some of the tobacco industry's manipulative market research, and then asks these regular people what they think. So it just shows regular people who are being exposed to something in a new way, which makes the audience think about that in a new way as well. And the point here was really to get regular people who may not be smokers themselves to learn about why they should care about the way that the tobacco industry manipulates consumers. And this is a particular challenge in health and in sort of the social determinants of health, because sometimes it's hard to communicate to people how all of these things affect them personally on a day-to-day level. So by showing specific examples and showing regular people discovering the same thing, you can really make connections with your audiences. The next way you can do this is to appeal to universal hopes and values, and this is another thing we talk about a lot. Hopes are what people hope for the future, for themselves, their communities, their families. Values are what people hold most dearly to themselves. It's what gets them out of bed in the morning. It's what they really think about as sort of their core operating principles. And the way the Human Rights Campaign and the LGBT movement did this really effectively was shifting the conversation strategically away from focusing on legal rights and legal sort of issues toward common aspirations like love and commitment. In this case, this ad that you see, everyone viewing the ad can relate to the desire for a family, for a loving, committed relationship, and talking about marriage equality beyond this sort of legal rights framework and shifting it more toward universal aspirational values really connected to people in an emotional and an intuitive way that made them more aware of the real issue at hand. And again, thinking about the Health Happens Here campaign, one of the challenges that we've seen is how to make this social determinants seem relevant to people who live in maybe healthier or wealthier communities. And so focusing on shared values will really help to increase that desire to help. Like, for instance, every parent wants to have healthy food for their kids, or every parent wants to have clean air for their kids. Those are places to start where you really can leverage those universal values. So another trait these campaigns had in common is bringing together a diverse coalition under one umbrella. And we think this is particularly relevant to the endowment because you have so many issues that are related that you need to sort of bring together under the common umbrella of health. So the first way you can do that is really what we say connecting the dots for a coalition. This is the Heritage Foundation. I'm sure many of you are familiar with it. I'll just read the quote on the left. Heritage has a formula. We create the key foundational paper. When we started in 94, 95, 96 to build the coalition, we had to do things well. We had to build the argument. Right from the start of when they founded the organization, they helped bring together a coalition of social conservatives, economic conservatives, and people from across the conservative sort of point of view in order to advocate for the same cause. So they wrote and distributed memos. They came up with positions on policy issues, and they really brought everyone to the table and told them what they should be saying. And this creates message discipline, it creates consistency in communications, and it's really been effective, as I'm sure most of you know, and as Daniel pointed out in those slides. They're simple and to the point. And so providing the coalitions you work with not just facts and figures, but also message research and messages about why this is important, why this taps into their own hopes and values, can be really helpful. Another lesson we wanted to share is that personal connections really help to build consensus in these types of movements. For example, Grover Norquist, who I'm sure a lot of you have heard of, very effective strategist. He has weekly sort of meetings in his house to discuss strategy and message with other people from the conservative coalition. So really bringing people together personally in order to get everyone moving in the same direction. The image on the right you see here is an example of how you can track how effective your messengers are being. This is something we helped create for the Gates Foundation for their polio eradication efforts. They had a list of messengers who they wanted to advocate for a cause, and so we measured how much they were talking about polio. That allows them to target their strategies a little more and be a little bit more focused on the people who can help them. And this doesn't have to be fancy. You can think about people who might be able to help get the word out about the campaign and really become evangelists. But that's really a good way to build consensus around big issues like health. So the next trait is branding the goal so that people embrace it. The best example really of this is the Human Rights Campaign. The logo speaks to a core aspiration of the constituency, which is equality. They want equality for themselves, and they immediately recognize the message without having to think about it. And that's the key to visuals like this. We want to make them intuitive so that people, when they see it, they have no time even really to think about it. It just makes sense immediately. That's something that we really think about a lot in terms of visual communication. So that's something that we wanted to share that's very important. Another way to do that is to use aspirational brands to motivate people for social causes. Live Strong has had some troubles, but really remains sort of a very strong community and network. They're branded very effectively, and their brand is a promise. It's that will help you live strong by providing you with information, resources, community. Much like the Human Rights Campaign, Livestrong has encouraged people to adopt this motto as part of their personal identity, so as a way to symbolize their belief in perseverance, strength, wellness. You'll see this picture on the right here. This person actually has it tattooed on their arms. But we really want to think about how to motivate and empower people to personally get involved with a movement like Health Happens Here. Really, to make a strong personal connection, you can brand this in a way that really helps to fuse with the audience's core identities. And you'll see this quote on the left of the screen. Is the difference for this brand is it transcends cancer, brings hope to patients, survivors, their families, and then it even went beyond that to society in general, and it says, together we can overcome anything. And then another way you can do that in this section is to use personal empowerment to drive social awareness and action. And you'll see on the left here, we say, helping people act on their personal passions while advancing your cause will create passionate advocates while drawing attention to the social problems and the systemic solutions. This picture here is again, part of a Livestrong cycling race they sponsored as part of an awareness campaign. The race is obviously taking advantage of people's empowerment and identities as athletes, which is something Livestrong has fostered, but it also raises awareness for cancer research and helps grow their list of supporters. It's important to remember that social causes and empowerment campaigns can be really brought together and complement each other in really effective ways. And for any health-related campaign like the ones that you all work on, this is very relevant. So another shared trait is making it meaningful and easy for people to be part of the solution. This is something we see a lot in our work. There are times where people aren't sure exactly how to get involved or how to make a meaningful contribution to a cause. So what we really want to do is think about how do we make it easy but also meaningful to give people a chance to be part of the solution. So one good example of that is the Dreamers, people taking action to help achieve their aspirations. And this is sort of the direct action piece. You'll see on the left here we say the Dreamers have recruited activists not just by calling attention to an issue, but by creating a sense of shared aspirations that are stymied by unfair immigration laws. And so mobilizing becomes an act of self-expression. So you really connect the action with people's hopes and values. This is a picture from a sit-in where Dreamers were demonstrating what they wanted to accomplish individually and how they could contribute to the country and society. So they're literally attaching their own aspirations to their activism. And something to consider in mobilization efforts is how alleviating social determinants can help achieve the aspirations of people you're working with. So that's something to keep in mind here, and really good lessons from the Dreamers campaign. Another way that we can make it easy for people to be part of the solution, this is sort of related to the earlier point about Livestrong, is you can use brand ambassadors to draw awareness to the cause. Of course, it's helpful when you have a very recognizable, wearable brand like Livestrong. And by wearing this bracelet every day, Livestrong supporters broadcast their support for the cause to almost everyone they meet. It increases awareness about the problem, the organization, and the person who's wearing it. It makes them feel good about being part of the process and being part of the solution. And this is obviously Secretary of State John Kerry, who became a brand ambassador for Livestrong. And this using brand ambassadors to help spread the message is a very effective way to expose the campaign and to get more visibility for your work. So another trait here is to communicate the social and environmental influences on people's well-being. One important thing in terms of policy work is to really try to reach across issue silos to help connect the dots. This is an example from the Robert Wood Johnson Foundation, who's done, as I'm sure most of you know, a lot of work on social determinants. One of the key recommendations of a report they commissioned was to try to break down decision-making or policy silos that separated health from things like education, transportation, or housing. What you see on the screen here is a quote from an Assembly staff member who we interviewed about how the endowment could communicate more effectively with policymakers. He works primarily on transportation issues, And he said it would really open people's eyes on the committee if more health-related organizations got publicly involved in transportation by showing up at hearings or writing letters or in support or opposition of legislation. So we know that this is probably something that you're already thinking about and probably already doing, but as evidenced by this person's experience, there's a lot of opportunity to help make connections between issues that might not normally be connected to people like that. So another thing we can do is just to bring in diverse experts who can help validate and spread the message. This is, again, from a campaign we analyzed. And this is a video of a professor of medicine who's explaining how architecture can improve public health. Academics sometimes are stigmatized as poor communicators, but when used appropriately, they can really lend authority to arguments. And especially when talking about these complex policy issues, academics are one of the most relied upon audiences. So for issues related to the social determinants of health, where the causes can be complex, multivariable, and really cross-cutting, it can be helpful to have an authoritative expert from another field to help validate and spread the message. And so the last thing we show here is just to use surprising facts and figures to connect the dots for policymakers. As we said before, surprise is a really important emotion to use. It helps with retention and motivation. And so the more you can surprise someone and create an emotional connection like that, the more likely they are to remember what you're saying and get involved and help. What we see here is this is actually from the quotes from a chairman or former chairman of the Harvard School of Public Health. And this is during the Clean Air Act debates of the 1970s. They were instrumental in convincing skeptical policymakers about the damages of poor air quality by showing them studies that quantified not only the number of deaths, but also the public economic costs that poor air quality resulted in. So you see the quote here: "We provided the basis for quantifying how many hospital visits, asthma attacks, COPD cases, heart attacks, and how many deaths were associated with these air pollutants." Completely changed the discussion. So thinking about how we can open people's eyes to this problem and to the solutions with surprising facts and figures that they might not already know about is a great way to engage people in the cause, and also to really communicate this environmental and social impact in a way that they might not have thought about previously. So that's a lot of food for thought there, but we'll leave it there, and hopefully there are questions we can answer. But thank you for your attention. We'll throw it back to Daniel.
Yeah, hey RJ, this is Jim Ketty. I'm actually going to step in here, and we did get a question just through the chat function now about one part of your presentation having to do with Live Strong. And I thought it would just make this more fun and interesting just to take that question right now. We'll do the rest of the questions at the end, but the question was this: it seems odd to use Live Strong as a model when its main association is with Lance Armstrong, liar, cheater, and drug abuser. So do you want to respond to that?
Sure. Yeah, I mean, we're not necessarily saying that you should use it as a model, but what we're saying is that the cause of Live Strong lives on beyond Lance Armstrong. There are tens of millions of dollars that come in donations to them per year, and that they spend on their programs. And it's really become a brand that's transcended him and will survive beyond his own transgressions. But the point here is that it's not that the California Endowment should get involved with Live Strong, or that Live Strong is even necessarily relevant. It's how they've used their own brand to become a wearable. They've really infused their brands with people's personal identities, and that continues to this day, even after what Lance Armstrong has gone through.
So is what you're saying, RJ, kind of in your look at Live Strong, that the brand, the message is in fact bigger than the Lance Armstrong situation, and is kind of now moved away from it?
Yeah, absolutely. I mean, I don't know offhand how their finances have changed over the years, or whether they are, have much less money than they used to, or anything like that. But they're still around. They're still advocating. They're still raising money and spending money on programs. But it's I think they lost their their sponsorship with Nike as a result of all of that, but they're still generating a lot of brand revenue, first of all, but also there's still people who wear those bracelets every day and who pay attention to what they do and consider themselves to be part of that community. And so even I think the fact that it does live on beyond just that one individual shows how strong a connection like that can be for people.
Great, thank you. Okay, now what we're going to do is in the final part of the presentation here is move on and hear some more from Daniel Zingale on how the endowment is using narrative to help drive norms change. I do want to remind you all, please go ahead and submit questions through the chat function. And in just a bit here, we will be taking the questions that have been submitted. Okay, back to Daniel.
Thanks, Jim, and thanks, RJ. So we won't have time to go through all of the important points that RJ just went through and look at the endowment's current campaigns through those lenses, but we'll do a few of them. And before we mentioned the Health for All campaign, this is a campaign that's primarily focused right now on raising awareness among Californians of the facts around undocumented people and their relation to health and the health of our state. Again, I think we've made some progress in terms of finding a concise, easy to digest and repeat and disseminate message and the Health for All message. But as RJ pointed out, it's also important that you humanize that message and that you bring in a diverse coalition around it. So these Health for All campaign ads have all really been about amplifying the voices of real undocumented Californians and their experience in the healthcare delivery system or more often outside of it. The other thing RJ mentioned was that it's a good thing to surprise people. So one of the things we found from a little research is that most Californians are surprised to find out that undocumented people pay taxes. Their first assumption, and a lot of misinformation out of the media, suggests that these are people who take from the healthcare delivery system but don't put in, when in fact, for the most part, the opposite is true. Undocumented people pay taxes, actually pay into systems like Medicare, but are most often excluded from being beneficiaries of those programs. This one visual you're looking at here obviously portrays a diverse coalition, but interestingly, it's also a riff off of an old Norman Rockwell, which was called Peace Corps, and actually had John F. Kennedy in that front position, and it was a depiction of the kind of a new generation of leaders in the 1960s. Sorry about that, you guys. This is really, what you're looking at here is the health presentation that Dr. Iton made at the front end of this webinar, brought to life in a campaign ad, and a campaign we call our zip code campaign, which really brings the disparities into sharp focus. One of the things RJ talked about was the importance of opening people's eyes, getting their attention. These ads that showed the gap in life expectancy by zip code certainly gets people's attention. This ad campaign actually has had mixed results in terms of the reactions it gets from different audiences, but it certainly gets people's attention, certainly a creative way of raising the disparity issue and its relation to place. The other thing you see going on in this ad is something RJ referred to as branding, which is giving people a visual. Even more important than words is giving people a symbol sometimes that they recognize that connects a lot of different things together. In this case, it's that pin drop, which symbolizes place with the branding, Health Happens Here. The other thing RJ mentioned, which we think is really important, is to give people an easy way to be part of the solution. This isn't, in our work isn't just about raising awareness, but it's also about engaging and empowering people to be part of the solution. So this is a very current example of a campaign we have going on called These Are Children. It's about the refugee children coming from Honduras and other parts of Central America, hundreds of whom are now in California. Again, there's been a lot of misinformation, a lot of noise, and political vitriol about these children, but the simple fact that they are kids and an opportunity for people who want to disassociate themselves from all of the shouting was not really present. So in this little website we created, we gave people an opportunity to send messages to children, write letters, drawings, We even have people submitting music that we're going to deliver to the kids. This has had a tremendous response, including from a lot of young people and children who are writing letters. And we think actually it's helping to change the narrative. Shortly after we launched this campaign called They Are Children, the Governor Brown, issued some really positive statements. The first 3 words out of his mouth were, "These are children." The Vice President of the United States, just in the last 24 hours, I think, said the same thing. So what you find is sometimes when you put a positive competing narrative out there, it begins to echo in important places, and I think that may be what's going on with this They Are Children campaign. This is one you guys may have seen around raising awareness of the health hazards of junk drinks and their connection to the obesity epidemic and the diabetes epidemic in the state. Again, I think the team did a very creative job of getting people's attention, kind of surprising the viewer.
And, just to comment on this one, too, this is Jim Keddy just jumping in here. One of the things we found is showing the link between soda and diabetes is far more jarring than just the link between soda and obesity. I think we all have a sense for the kind of suffering that folks with diabetes go through and children go through, and by making that link, it definitely grabs one's attention much more strongly than obesity by itself.
Right, and another important point to make there is this again is an equity issue. Some really disturbing data just out this week from UCLA, I think, about the disparity in amputations related to diabetes with regards to income, disproportionately affecting lower income people. This just happened in the last 48 hours. This is the front door main entrance to the governor's office in the state capitol, where we were able to secure kind of an unprecedented way space, raising awareness about the imbalance between what the state spends incarcerating a young person versus schooling a young person. A very timely debate as competition for resources between those sectors is kind of going on hot and heavy right now. We obviously believe that health happens in schools. That's an important part of our vision for public health. So this is turned out to be a provocative way to raise this issue. It's getting major traffic on social media, pro and con, but it's certainly changing the narrative and getting the debate going.
So many of you are probably wondering, how did the California Endowment manage to get this big sign plastered on the wall next to the governor's office? And Daniel, how did that happen?
I'm wondering that too, actually. All I would say to that, Jim, is be bold and sometimes even ask when you're not sure you're going to get a yes, and you might be surprised.
Ask and you shall receive. Yes. Okay. All right. Well, that is the material that we wanted to go through. As you can see, we covered a lot of different examples of narrative change and its relationship to social norms and getting people to think differently. Now we're going to go ahead and jump into some of these really terrific questions that have been submitted. And I'm going to go ahead and loop it back to Tony Iton, our original presenter, and find the question here about health and education. And Tony, are you with us?
I'm here. Can you hear me?
Okay, Tony. Yeah, Tony. So the question is, what is the relationship between student health and academic performance?
Student health and academic performance. There's some very good data actually that suggests, and this this is correlation data from the California Fitnessgram that shows the youth that have the highest level of fitness and the lowest level of overweight also have the highest API scores. And there's some other correlational data that looks at this as well. So the belief is that the old belief was that if you emphasized physical activity and fitness in schools, it would detract from academic performance. In fact, the opposite appears to be true, that kids that have the opportunity to exercise and eat healthy and engage in activities that lower their weight and increase their fitness actually perform better in schools. If the person wants specific citations for that, they can feel free to get in touch with me and I can send them citations.
Great. Thank you, Tony. Okay. Here's another one that we're going to steer over to Daniel, and this question is from Adam Ward in City Heights, San Diego. Hello, Adam. Do you find any examples of low-budget grassroots campaigns that started locally and spread to the nation and beyond?
Great question, Adam. I think most of the best ones have, in my experience. I was somewhat involved with the early HIV/AIDS movement, and I would say the quilt, which started very grassroots and became a world phenomenon. The AIDS quilt was clearly a narrative changer. But maybe even better example is the United Farm Workers Union. Again, RJ talked about the importance of branding. Symbols are even more important than words. The UFW eagle is now an iconic symbol for farm worker justice, known worldwide, and that, of course, started at the humblest of places. But they were smart, and one of the things those of us like you, Jim, who are familiar with the movement know is that Cesar Chavez and his fellow workers, they were very intentional about marketing. They knew the power of media and marketing, and they used it in a very intentional and unapologetic way. So I can't think of a better example of a brand and a message that really changed the course of history.
Great, thank you. So also for you, Daniel, here's a question about the development of messaging, and it's from Catherine. How do you recommend developing a process of developing messages that is through a participatory process from start to finish? It seems like this sort of more of a grassroots process could support the adoption and dissemination of messages that are authentic and community-based.
Great question. Again, I think this is how the best messaging happens. And the first thing is to demystify it for yourself and others. Don't be intimidated by all of the kind of mystery and fancy PR talk that goes on around this. Good messaging is nothing more than understanding who you are, what you stand for, and then putting it in simple terms that other people can relate to and join you. So I've always found the best development actually happens outside of formal focus groups or polling, but in bringing people together. So be aware when you bring people together to have it be a diverse group, not groupthink, the people that will challenge each other's assumptions and biases. But the best messaging I've seen emerge from people getting together saying, really digging deep down and saying, what is it we're trying to do? What do we stand for? How do we boil that down? And then again, being disciplined about deciding on a means for communicating it and a commitment to disseminating it. That's a step we really get stuck on because it's hard and it's resource intensive. But if you're serious about messaging, you have to, bring it up authentically, but then hold tight to it and commit to disseminating it. One of the things I notice we choke on sometimes is, wow, is it really going to cost us that much time or that much energy or that much money to get this out there? How come we're spending so much of our time or money on disseminating a message? And that's really the only way to have an impact is to get serious about putting what you have behind it, whether it's few resources or just blood, sweat, and tears.
Now, so Daniel, as an example of a kind of the community involvement and message development, could you share with folks how you landed on Health Happens Here as one of the messages that the endowment is using?
Sure. So we kind of put ourselves through a similar exercise internally here. We had internally come up with the name of our core initiative, Building Healthy Communities, just here in the foundation walls. But we knew we had to carry a message that was more values-driven than the name of our initiative. So we asked ourselves again, what is it that unites all of our diverse work? And after a period of weeks of kind of soul-searching and conversation, we realized that fundamentally what we were about was challenging the conventional wisdom about health, challenging the notion that health just happens in a doctor's office or that health is about a person's good behavior or bad behavior, that it's actually affected by surroundings. So the best we could come up with in the walls of the foundation was something like health happens in community, I think is about where we landed. And we were ready to roll with that until we did what I just described and actually went out and gave it to people and said, what do you think about this? Can you come up with something better? Does this mean anything to you? We're fortunate at that point to be engaged in our place-based work, so we had relationships and community. And one of the most important things we heard was, you have the right idea about where health actually happens, but it's in the wrong voice. you're speaking from the voice of a foundation talking over community or talking to community. When in fact, if you put that same idea from the voice of community themselves, it comes out differently. It comes out health happens here. And as soon as we heard that, I think most of us recognized that community had done a better job than we could at expressing it in fewer words, in a simpler phrase, in a more portable phrase, and in one that would resonate beyond the world of foundations.
Great. Thank you, Daniel. So, Tony, I'm going to come back to you with this question. This has to do with data. And the question is, in order to engage people in social change, you need both the human appeal with people's stories, but also with new information in the form of statistics and figures. What sources of information or research are foundations producing that will complement the human experience, and how do we reach out to people going into the field of math and science to work toward producing research that will be used by community organizers and community-based organizations in order to promote the cause at a grassroots level? I know this is something that Tony has done a lot of work with, as you saw early in the presentation, the way he's incorporated life expectancy statistics to, again, create a jarring moment and draw people's attention and use that data creatively. So, Tony, what are your thoughts on that?
Well, the first thing I would say is that there is a lot of data out there that is of use to these kinds of efforts. Oftentimes people think that the problem is a lack of data, and I would argue that it's not a lack of data. I would argue that it's how the data is translated. How is it made accessible to people so that they recognize the information that the data is trying to convey in a way that's compelling. And so one of the things that I noticed that probably about 15 years ago in doing this work is that when we made the early move to using maps in Geographic Information Systems, or GIS, where you could actually show somebody a map of their community and have them point out their house, and then layer data on that community to show the phenomena that were happening around them in a spatial way. People related to that data in a much different way than they would if they saw it in a chart or a table. And we noticed this in particular for two important constituencies. One was politicians. They were much more able to read a map and to look at a map and to feel kind of accountable to phenomena that were layering themselves geographically. And the second important constituency was the media. The media love maps, and if you can show a phenomenon occurring in a mapping setting and allow them to get the raw data and to reconstruct the map themselves in the newspaper or online in some other way, they will have a lot of fun with that. And so the point of it is, I think that the key is to make the data accessible and relevant to people where they live and in a context in which they live. And that kind of data is much more useful than just having reams and reams of charts and tables that very few people can interpret.
Great. Yeah, thank you, Tony. So the next one I'm going to send over to RJ. This is a nice kind of critically minded question. How do you measure or evaluate the effectiveness of each campaign? How do we know we're really moving the needle and not just producing pretty ads?
Great question, and something that a lot of organizations really struggle with, particularly in the digital age when things are, it's easy on social media to see sort of vanity metrics of likes and retweets and followers and things like that. The way we think about it is that there are three things that communications can achieve, and all of them are measurable. One is raising awareness, changing attitudes, and then taking action. So on the first two, the raising awareness and changing attitudes, that can obviously best be done through sort of quantitative surveys over time, but you can also do even smaller, more targeted surveys of people, either through informal online focus groups or through even conversations in the areas where you're working, where people may have seen ads that are either on TV, the radio, in print publications, or online. There's a lot of analytics that you can get through online advertising if that's something that you're looking for. And really importantly, on the mobilizing people to take action, the way that we always measure that is by always ensuring or trying to ensure that every communication that we put out there has a call to action and has something for people to do. Because if that's either a click-through or an email or a phone call, you can measure all that stuff really easily. So we try to at least identify from the beginning, are we creating an ad to raise awareness, change attitudes, or inspire people to take action? And then you can sort of figure out how you want to measure it based on those objectives. I hope that's helpful.
Yeah, so it's kind of a question going in the same direction, RJ. When crafting the campaigns, how specific do you get about audience? Can you define or describe who your target audience was?
Yeah, I mean, our mantra is to know your audience as intimately as possible. So at this point in the way the technology has progressed, you can get beyond just, especially online, you can get beyond just demographics, and you can get to psychographics or, even in more depth than that. So there's no point at which you should try to not understand more about your audience. The way advertising and particularly big picture advertising has worked for a long time is that they appeal to specific demographics based on what they know about who watches what TV program, and that's significantly sort of out of date. So with online communications and with sort of targeted messages, we want to be as specific as we can, and there are ways to do that. One way is through even audience research, just in-person conversations or on the phone, you can ask a series of questions that will help you identify exactly what different people have in common, and you can target your audiences that way. If you're using online sort of ads or online communications, it's much more sophisticated now, so you can get down to a level of detail that we've never been able to before. So I would encourage everyone to try to learn as much as they can about their audiences. And if you're doing this particularly through grassroots communication and just reaching out to people, you need to explore what we would consider to be the most important would be to explore their motivations, their reasons for getting involved, what they're interested in doing, and sort of start to profile your audiences that way as opposed to demographically, because not all people ages 18 to 34 believe, are motivated by the same thing.
Right. Thank you, RJ. Yeah. So we're going to roll back up here to the very first question, which comes from my friend Stella. How would you respond to the recent SAC-B coverage of the governor and others taking money from big tobacco? Is big tobacco no longer radioactive? And what Stella's referring to is this recent research from the Sacramento Bee that's lifted up the fact that now there are some Democrats taking money from the tobacco industry, whereas in the past that was sort of anathema within the Democratic Party, and the governor himself is taking funding from the tobacco industry. There's been attempts recently to pass some new legislation affecting electronic cigarettes that has been gotten stuck in committee. And I can tell you, as someone who worked on tobacco issues at the Capitol for about 10 years, it's really been raising my blood pressure the last couple of weeks looking at those dynamics. But is tobacco no longer radioactive? Daniel, what do you think?
Well, being pro-tobacco is still not a winner with voters. It's still a negative. The problem is that the counterbalance to that, the influence of money in our political process has been on the ascension. It was always big, but now it's getting bigger because of recent court decisions and the concentration of wealth and economic opportunity ever more at the highest echelon. So that concentration of wealth translates into a concentration of political influence. And so a legislator has kind of a Sophie's choice to make. They know taking tobacco is going to get them some heat, but they also know that they're ever more dependent on money to win elections. So I'm afraid it's that corrupting power of money that's the problem here. And the only thing you can do to combat that is to shine a bright light on that kind of corruption and anti-public health behavior, whether it's tobacco or all the other things that are enabled. bad decision making, and that's what makes this exercise so important.
Yeah, great. I had a question here about the website for sending letters to the refugee children around the messaging. That website is theyarecchildren.com. Yep.
You can also go there through the California Endowment regular site.
Yeah, great. Okay, here's another one for RJ. In your research, RJ, can you talk about the interplay between the creative work, ads, the banners, messaging, and the engagement online activities that were part of the campaign?
Sure. Yeah, and I don't know if that's a specific campaign that we used or not, but I can just speak generally. These, and it sort of speaks to the answer that I gave before. In our opinion, all of these communications with audiences, especially when they include a call to action, should all be related to each other in some way. So the billboards and the print ads and the television ads should be driving people to the website, and the website should have links to the billboards, the TV ads, and things like that. I know the endowment's doing that through using specific hashtags and things that are integrated between sort of online and offline. But as much as possible, the offline advertising and messages should be driving people to take an online action of some kind. In the world we live in, that's really the most effective way to engage people. Does that address the question, Jim?
Yeah, I guess the other thought I had, RJ, just thinking back to your examples, is when you see organizations holding large engagement events, you see this with groups working on cancer and tobacco, Walk for Life, and then you really see an integration of the messaging in with some kind of large community engagement event. Is that, do you see that as well as part of?
Oh, yeah, absolutely, yeah. And as much, consistency, and starting with the consistency of the brand, the organizational brand, once that's sort of solidified, like in the case of HRC, they have their brand, so they can kind of spin out, offline activities that still reinforce their brand that people might interact with mostly online. And a lot of that is a specific way to ask people to go back and do something, or to go out in their community and do something. And the the Obama campaign in 2008 was the first, I think, really big example of how to create action offline through online means. The house party concept, the other ways that they sort of organize people to come together in person using online means. So it can work in both ways. You can use the internet to kind of drive people to go out and do things in their communities, but you can also gather people from a broader spectrum and bring them into one point of interaction online.
Great. Okay. This next question is going to go to Tony. This has to do with the challenge around deep-seated beliefs. And here it is. I can see the value in these campaigns within certain high-functioning groups. But what about social norms change when it comes to populations with more deep-seated beliefs that produce self-harm?
Yeah, I've gotten this question before, and I think it's an interesting question. Some of the efforts here in changing the narrative require you to kind of lay out the truth, lay out the facts about how some of these inequities are shaping people's opportunities in low-income communities, and how these things have a kind of a cumulative and synergistic impact on people living in these communities, and that can leave people with a sense of overwhelm. And I think any of us feeling that way would feel, kind of like, it's hopeless. This is not doable, and that could lead to, a whole set of behaviors that could be self-injurious. And so what we found is that it's not just the message, but it's really kind of the action steps that go along with the message that are critical. Offering people an opportunity to come together to start to tackle some of these issues is a critical piece of the narrative change effort. So our work really focuses on building both individual and community agency. So people's ability to get involved and participate in the problem solving, but also to meet others that are similarly situated and to recognize that they're not alone. And so we think it's important not to just sort of use the messaging sort of as a standalone, that you have to tie it to an opportunity to engage and participate in a meaningful way, hopefully in a way that reduces a sense of isolation and kind of hopelessness that can ensue when you see all of these various forces arrayed against you.
Great. Thank you, Tony. Tony, I'm going to do this as a follow-up because it very much is in the same theme that we're addressing here. What about the reality that so many people ignore or deny facts and figures, for example, climate change deniers, especially in our polarized media context today, where we get info from media that confirms our existing beliefs?
Is that for me, Jim?
That's for you, Tony, yeah. Mm-hmm.
Yeah, so, I think that there's one big difference here, and that is that we can bring this data down to people's neighborhoods. And people are very, very interested in local data. That's like one of those pearls of wisdom for using data. One of the reasons that I spent a lot of time investing in developing these life expectancy maps from all over the country is that if I show somebody a map of Alameda County and they live in Milwaukee, they think somehow this doesn't apply to me in Milwaukee. And so it's critical to show them a map of Milwaukee and to show them where their neighborhood is and to ask them to disprove. If they're skeptical about data, disprove what they're seeing. Very few people, when you show them data that's immediately relevant to their day-to-day existence, can walk away from that and say that it's not true. All I would say is that if somebody continues to deny something that's, sort of immediately in front of their face, then you probably should move on to the next person because that person's not going to be helpful to you in this work.
Right. Thank you, Tony. Okay. Here, I think we're going to go back to RJ with this one, kind of our researcher voice. And this has to do, in the past, some campaigns have accidentally had the opposite effect of their stated intentions. For example, anti-drug campaigns, and I think the person here is referring to the DARE campaign led by Nancy Reagan, and there was research on its ineffectiveness. How do we avoid these mistakes going forward? In other words, something can seem very clever to us, but when we in fact start to roll it out, it may work against us. RJ?
Yeah, great example. And I think that, not to get too sort of political here, but I mean the war on drugs as a whole has been a really good example of mistakes that people make. And to me, what that all comes down to, two basic things. One is not knowing your audience well enough. So assuming that the audiences want to be spoken to or told what to do in a specific way that just doesn't connect with them. I think that was a huge problem of the DARE campaigns and sort of related efforts on that front. And then also the authenticity. I mean, they weren't able to connect with people in a way that made people want to believe and understand. They were a lot of those ads were condescending. They took a point of view of we're telling you what's best for you, and not trying to connect with people on a values level. So those kinds of things I think are pretty basic mistakes of not knowing your audience and not having the right voice for speaking to the audience. In contrast, if you're trying to reach kids, like we saw the Truth campaign and other tobacco campaigns have connected with youth by showing the manipulation of tobacco companies. So that's a way that very, very authentically just they're convincing kids to look at tobacco in a different way, and that's a really, really legitimately authentic way in connecting. So I think it's just a lack of knowing your audience and using an authentic voice, really.
Yeah, and that's the example where folks have moved away from talking about health impact of tobacco to young people and instead really lifting up the kind of evil practices of the industry, right?
Yeah, exactly.
Good, okay. All right, this next question we're going to go back to Daniel with, and this is from our friend Dina. This is something the endowment has really been struggling with, and RJ, in fact, has been helping do some research. How do we break down the complex social determinants of health and look at concrete actions that ordinary citizens can do? In other words, once we get their attention, what is an example of something we would suggest an ordinary person can do?
Great question, and I want to first, just in full disclosure, say we haven't figured this out, but I'd love to get some input from the people on this call at our first attempt, which is at our website. It's a page called Health Happens with Action, and it tries to answer that question. And the way we've attempted to do that is to give people kind of a three-step ladder of engagement. The first one being very personal, kind of meeting people where they are and making it easy, as RJ has recommended. So the first thing a person can do is really not so much about the social determinants, it's about personal behavior. So ride your bike to work, change up the lunch you pack, those kinds of tips like that, just to get people kind of in the door. But the second step tries to take people to more shared actions. So things you can do together in a community as a group. And that starts to bring into the conversation the role of surroundings. So can the first one, by the way, take your bike to work. We try to point out that in some places there are bike paths that are safe and accessible, and other places there aren't. But when you get to a more shared experience, then you've opened the door to a larger understanding of that. And then the third tier of options we have on that page are really civic engagement. Go to a town hall meeting, or go to a city hall or school board meeting. Take a group of friends or like-minded people. Really kind of engage directly in these policies and decision-making processes that affect the surroundings. But really would love to hear from people as to what's right and what could be better about that page.
Great. Thank you, Daniel. Okay, we're kind of headed towards the end of this, headed towards wrapping up, but I do want to take this one question for Tony, which is, what has been the endowment's success in deeper levels of engaging people beyond simple likes or shares? So in other words, beyond the kind of activity you see in the online sector around messaging, what is the endowment trying to do to create deeper levels of engagement with people?
Okay, I'm going to interpret this question as, what are we doing in our practice, and assume that, talking about community engagement what I'm going to talk about is basically our power building strategy. I'm not really in a position to talk about an online community engagement effort. I think Daniel could probably touch on that a little bit more, although he just touched on it in his last response. But in our work in place, we focus on what we call the drivers of change. And from the presentation I did at the beginning of this webinar, when you look at that upstream set of intervention points, really, in trying to change the health of a population, we derived the drivers of change. And I showed you what we call a power arc, which is really kind of at the heart of trying to intervene upstream to change some of the downstream outcomes. And in that power piece, we're really working in impacted communities and enlisting residents in those communities to participate in essentially holding the systems that serve those communities more accountable for more equitable outcomes. And to do that, we engage with organizing groups to literally go door to door and invite people to participate in efforts to identify things that are in their immediate day-to-day existence that are compromising their ability to pursue healthy choices. That can be anything: crime, access to food, transportation, access to parks, youth opportunities, you name it. And so we organize people, and we're deeply committed to this, an organizing strategy. And then we facilitate these organized groups to participate in these local decision-making processes. And sometimes I sum this up by saying, health is political. meaning that one definition of politics is the struggle over the allocation of scarce and precious social goods. And when we're talking about scarce and precious social goods, we're talking about things like a park or a grocery store. And whether there's a park that's well maintained in your community or there's a grocery store is really the product of a local political decision-making body. And the extent to which our communities participate in those decision-making processes dictate the extent to which they're likely to have equitable distribution of those resources. So we organize people to participate actively in decision-making in their communities and to hold these various decision-making bodies and systems accountable for attending to their needs. And I think that, quite frankly, when you look at the spectrum of community engagement, that is really towards the deepest level of community engagement that is on that spectrum, and it's the heart of our Building Healthy Communities effort, which is very different from most place-based health improvement efforts that we've seen other organizations engage in.
Great. Thank you, Tony. I'm going to go over to Daniel now for any kind of final thoughts and comments.
Yeah, I would just add 3 quick points to what Tony just said to answer the question about engagement. Just across the street from where Jim and I are here in Sacramento at the Capitol, there are more than 200 youth from around the state, and their 3rd day of action here on the steps of the Capitol, in the halls of the Capitol, advocating for common sense school discipline reform. I believe those young people who started this issue wasn't on any of our radar. They brought it up. They brought it to Sacramento. They brought it to the narrative change, really. I believe they're on the verge of the first ban in the nation on willful defiance, suspensions, and expulsions, which is a bad way of throwing mostly young men of color out of school. That's theirs, and they're over there doing that right now. Another example would be we have hundreds of youth who have volunteered for our enrollment effort for Obamacare around the state, at health fairs, door to door. The majority of the youth at our health fairs, which attract thousands of residents, the volunteers there are overwhelmingly young. They've helped to enroll 2 million Medi-Cal enrollees under Obamacare, which is about 1/4 of the new enrollment in Medicaid nationwide. And the third example I would give is that more than 30,000 Californians have signed and mailed a card to their legislators in the Capitol calling for health coverage for the undocumented in response to our Health for All campaign. So you talk about the influence of tobacco. The only way you can compete with that is to have tens of thousands of residents engaged in the process. And we're able to do that on the Health for All campaign via these cards and letters that have been coming in.
Great, thank you. RJ, any final thoughts you'd like to share?
I just want to thank everyone for their time and attention, and I really hope that this provided some food for thought for people, and just glad to see that so many people logged on to listen.
Great, thanks, RJ. Okay. So again, this is Jim Keddy, and I'm going to just do our next steps. I'd like to let everyone know that you will be receiving a follow-up email from us with a link to where the recording of this webinar will be posted. We will also make our best effort to answer any questions that we were not able to get to during the webinar in follow-up emails. We had about 172 folks participate in this webinar. This is our really our first attempt, in my understanding, of trying to get some of this kind of thinking and learning that the Foundation's been picking up and has been partnering with many others to gather through kind of getting it out to a large number of people through this webinar format. We have 2 more webinars in this series. We have one coming up on September 22nd, which is on social norms, change, and race. This is with Professor John Powell. I think many of you know is a leading thinker on structural racism, norms, change, and communications. He's going to help us think about how advocates can contribute to norms change in support of social, racial equity. And in October, we're in the process of scheduling the final one, which will be focused on health equity. That will be led by the Berkeley Media Studies Group. And finally, I'd just like to express my appreciation for everyone who's out there creating change in all the different ways that you are. Here at the Endowment, we are very proud to be your partner in this endeavor in support of social justice and health. And finally, let me just offer my final thanks to Sunena Sundi, our endowment staffer, who has really been the person who made this all happen, put it all together, made sure those of us who are over the age of 50 knew how to work the technology, which I'm sure tried her patience numerous times. And thanks again to everyone for joining in. Okay, bye-bye.
Ladies and gentlemen, that does conclude the webinar for today. We thank you for your participation and ask that you please disconnect your line.